So let's jump right into what it means to have a fixed mindset versus a growth mindset. And I have broken it down into 5 simple points to make it easy and achievable for you all, specifically as trainees and as physicians, to shift from having a fixed mindset to having a growth mindset. So the first point is going to be that the fixed mindset talks about IQ and it talks about results. So I understand that we all are super competitive people and we're high achieving, and that's why we're here. But it's really valuable to step back and realize that it's not all about the IQ and not all about the results. If anything, having a mindset that focuses on these things, it leads you to feeling internally and psychologically worse. And we know this from evidence that growth mindset is the best for our healing, for our growth, for development, prevents all sorts of psychiatric problems. So we've known through evidence that the IQ and results do not determine somebody's level of success in the life or level of well-being in the life. What really matters is them focusing on the skills and the learning. So what I love about the word skills is that almost anything that we do in our life can be broken down into teachable and learnable skills. So let's say for you, as a resident, as a fellow, as a trainee, as a physician, you feel that there are certain parts of your job which you're not the best at. Let's say you struggle in note writing. Let's say you struggle in making presentations. You struggle in talking with patients. So all of that can actually be broken down into specific skills which are teachable. Let's say note writing. It's a skill. You can learn about how to write notes efficiently and more accurately, which are most effective in communicating what we need to actually communicate in a note. So it's a skill that if you put your mind intentionally to, you can work on it and you can build your skills. And that's called having a growth mindset. Let's say you struggle with communicating with a patient or with your attendings. Again, all of that can be broken down into skills that can be learned with practice and some guidance. We can get better at it. So what your starting point of IQ was or what your results were in the in-training exams or your USMLEs, really at the end of the day does not make much of a difference to what your quality of you being as a physician would be. And that's what the growth mindset says, and I absolutely love it. The second point that the fixed mindset talks about is that it loves setbacks. What it does is whenever you have a setback, it jumps to 2 things. Either it turns to blame, which is, let's say you had a bad interaction, you had a bad score in the in-training exam, or you had a poor patient outcome. So what it does is the fixed mindset wants to start looking for places that you can put the blame onto but yourself. That's the one way it tricks your mind. The other way that the fixed mindset can trick you is that it can make you feel discouraged. So either it puts the blame on somebody else or it puts an extensive amount of blame on yourself. What does that lead to? Poor self-esteem or no growth at all. So what the growth mindset says is, what can I do to grow from this? What can I do to learn from this setback? So if you have a poor patient outcome, you sit down with yourself, you see, okay, what can I learn from this? If it was a fixed mindset, I already talked about what it's going to lead you to. Not helpful, growth mindset certainly helpful. The third way is that the fixed mindset does not like to make a lot of efforts. Why? Because fixed mindset talks about a little bit about pride. Oh, I'm good enough. So I've been here, I've come here. There's something that is pretty good about me. I have an excellent IQ. I've come so far. I don't really need to put in a lot of effort for an in-training exam. I don't really need to work hard for the boards coming up. And I don't really need to work on my skills about communicating with patients because I'm good enough. That's what the fixed mindset tells you. Whereas there is always room for learning for everybody. So the growth mindset says that efforts are pretty much needed no matter what your starting IQ was, no matter what your natural talents are. Everyone needs to be putting in efforts into whatever it is that they're learning in their life. The fourth point is that the fixed mindset loves perfectionism. Please apologize my bad handwriting. Okay, perfectionism and comparisons. Okay, so the fixed mindset is a little bit absolutist. It likes to think in extreme ways. It says that I have to do this perfect or it's not great. Whereas the growth mindset says that you got to be flexible. And I could just talk more and more about a separate whole lecture on what perfectionism means and how to become more cognitively flexible. For now, I just want to touch upon it in the context of our learning. That even in our learning, we don't have to be perfect the first time. We actually never have to be perfect. We have to keep learning and getting better. It doesn't have to be perfect because in reality, perfectionism does not exist. It's a myth. And it causes a lot of pressure, mental pressure. And so let's not even get too much into it. The second piece was that the fixed mindset talks about comparison. So it's always looking at your fellow residents. It's always looking at your fellow attendings. And you're always comparing, oh, they have an excellent way of talking. And I suck. I'm not good enough. And it's constantly viewing yourself from the lens of how good other people are doing. Whereas the growth mindset uses those comparisons, A, to feel inspired, that what can I learn from this? And B, it focuses on your individual strengths and individual weaknesses. So when you focus more on your own growth, then you're looking at a very 100% clarity that these are my strengths, I will build on those, and these are my weaknesses. What can I do to get better at these things? So that completely non-judgmental approach, not comparing yourself to other people, but focusing on the individual growth. And the last, but not the least point is that the fixed mindset loves to look at the small picture of things. So let's say you had a really bad day at work, you had a bad patient outcome, your attending kind of yelled at you, or your patient yelled at you, or you had a really bad score in the in-training exam, or you failed it. So the small picture is going to be that, oh, this day or this event defines the rest of my career. This event defines who I am as a physician. Or this day defines how good I am at whatever I do, and it pretty much says that I'm probably not good enough. Whereas the growth mindset says that you got to focus on the big picture of things. Failing one exam, not doing great in one test, having one bad patient outcome a day is not going to define your level of expertise as a physician. Got to focus on the big picture of things, how far you have come. There's so many obstacles in your life that you've overcome, so many challenges. You may have failed a bunch of tests, but you tried over and over again to get here, to be here. So you want to focus on the big picture of things, and that's the growth mindset.